Hello everyone. Thanks for joining me today. We're going to talk about something that's always fun. Taxes. Specifically, we're diving into the Medicare Levy. Don't worry, I'll make it as painless as possible. So, what is this Medicare Levy? It's an extra amount you pay on top of your normal income tax. This levy helps fund Australia's awesome public health system, Medicare. Medicare has been around since 1984, and it's there to make sure we all get the medical care we need. Now, how is this levy calculated? For the 2020-25 income year, the rate is 2% of your taxable income. So, if you're paying the top income tax rate of 45%, you're actually paying 47%. Not 45%, not 46%, but 47%. Tax math. Now, let's talk about some good news. Relief and exemptions. If you earn $26,000 or less, you pay no levy at all. If your income is between $26,000 and $32,500, the levy is reduced. So, a little extra cash in your pocket if you're a low-income earner. Let's break it down with an example. If your taxable income is $27,000, your Medicare levy will be $272.40. You are not charged for the whole 2%. If you like to find out the exact amount that you would be charged, use ATO's Medicare Levy Calculator. If you have a family, there are higher income thresholds. If your family income is $43,846 or less, no levy for you. And for each dependent child or student, add $4,027 to that threshold. Here's an example with a family. Jason earns $12,000 and his spouse Sarah earns $52,000. Their combined income is $64,000, which is above the family threshold. But Jason's income is below the individual threshold, so he's exempt. Sarah, however, has to pay the full levy of $1,040. Now, who else gets exemptions? Non-residents for the whole year don't have to pay. If you don't qualify for Medicare benefits, you might be exempt too. You need to get a Medicare entitlement statement to prove it. Some medical exemptions apply as well. Blind pensioners, those on sickness allowance from Centrelink, and those with a Defense Force Gold card. But remember, if your spouse or kids aren't exempt, you might only get a half exemption. Here's an example. John serves in the Australian Army for the entire income year with the taxable income of $48,000 for the 2020 year and is entitled to full free medical treatment. John's wife, Apple, is not entitled to full free medical treatment and does not fall within any of the exemption categories. Apple has no taxable income and will therefore pay no Medicare levy. They have one child who is also not in an exemption category. John is in a Medicare exemption category for the whole year, but his spouse and child are not. Therefore, John only qualifies for the half exemption. If Apple earned $55,000, John would be entitled to the full exemption, as Apple has to pay the Medicare levy. John serves in the Australian Army and gets free medical treatment. His wife Apple and their child don't qualify for exemptions. So John gets a half exemption because his family doesn't qualify. But if Apple earned $55,000, John would get the full exemption. So, there you have it. The Medicare levy in a nutshell. It funds our public health system, but there are plenty of exemptions and reliefs. I hope you found this helpful and maybe even a little entertaining. Thanks for listening, and may your tax returns be ever in your favor. Feel free to ask any questions or share your tax woes. Thanks, everyone.